Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today's Monday, May 18th. Let's jump into the numbers from the 8 counties in the capital region. We could maybe call this Good News Monday. Things are actually improving nicely. From Friday to today, we can see the inpatients have gone down in hospitals in those counties, patients who are from those counties, from 118 down to 108. And those patients who are in ICUs has gone down from 31 to 23. Inside here in the medical center, this is a graph that you're also familiar with. You have the horizontal line. Above that are new patients who come into the hospital. Below that line are patients who have either been discharged or who have died in the hospital. You can see currently we have 47 people in the hospital that we're treating for COVID-19. We have 40 on the floor, and we have 7 in the ICU. And you can see the purple line that tracks patients continues to trend down. 47.
You know, Dennis, there's a number inside that number. So of the 47 patients that we have in the hospital right now, 37 of them come from congregate living facilities.
Congregate living facilities. What's an example of a congregate living facility?
Nursing homes.
Nursing homes?
Group homes.
Group homes.
Places where people live, not with their family, but with others in that kind of circumstance.
So if 37 of the 47 come from congregate living facilities, then obviously that means 10
are from the community at large. So like you and I, living with their families or by themselves or whatever. So the vast majority of them are from those group homes, the nursing home kind of setting.
All right, so let's, on a going forward basis, we'll break those numbers up for people as we go forward. Let's talk about those people that are here, the 37 who are from congregate living facilities such as nursing homes. We can't discharge them back to a nursing home until they're COVID-19 negative.
That's right. So today, Monday on the 18th, we have 21 nursing home residents who we can't discharge back to their homes, their nursing homes. And the vast majority of those are COVID positive patients who are no longer acutely ill, could go back to the nursing home, but can't because of the restrictions that are in place.
And are there any things that we're doing in particular with that population, cohorting them?
Yep, we're cohorting them. We have them on one unit. You know, we're not mixing them with the general population of patients in the hospital. So we're being careful, but they are kind of waiting to go back to their normal living facilities.
All right, very good. So we'll track that going forward. That number.
More
Excellent.
Later in the week.
We heard the governor's press conference this weekend and again today about the businesses in the capital region being able to phase in. Phase 1, I believe, is supposed to start sometime this week.
We hope tomorrow. And so that's manufacturing, construction, and retail with curbside pickup.
Now, this is not specifically about the activities here in the hospital. That's different. We've been able to start doing our medically necessary or elective procedures again since last week. How are we doing there?
So we're doing well. So we had a good week last week at South Clinical with 70 cases done there. We're going to start to ramp up, I think, actually tomorrow. We are in the mid-30s in terms of the scheduled cases. We've also approved the plan today for the opening of elective cases on the main campus and Niskayuna. Both of those will start on Tuesday next week.
Fred, I haven't asked you this question in a while, but people may be wondering, how are we doing on supplies, PPE, masks, those sort of things?
We're doing well, Dennis. You know, we've been very careful in terms of how we've used all of those supplies, and I'm happy to say we have adequate numbers of supplies. For surgery, there are these special packs that they use. We'd actually bulked up, if you will, on those packs back in February. So we've got adequate numbers of those in storage here, plus all the usual stuff, masks, gloves, gowns, etc.
And back to the procedure starting at South Clinical Campus, etc. We're still within the 70% threshold as far as not exceeding that.
South Clinical Campus in particular really doesn't use any resources on this campus, so that's not a problem at all. But even as we ramp up on this campus, we'll still be able to remain within those boundaries.
Antibody testing, we promised that this week we would provide an update to our workforce, specifically about the enrollment in a research project where we're going to look at antibodies. And if you haven't seen this yet, there's a messenger which came out today on that, and there's a way for people to sign up if they wish to volunteer to be in that study.
It's a simple survey We're looking for 200 volunteers. I think we'll get a lot more than that. 3 categories. No exposure, no testing for COVID, no symptoms. That's category 1. Category 2 is symptoms and a positive test. Category 3 is symptoms and a negative test. Right. So I just did the survey.
I did
Dennis,
too.
You did the survey.
I hope I'm selected.
Pretty simple. Me too. Me too.
Yeah. And
we won't be.
Yeah, probably not. Yeah. Okay, very good. Any questions for me, Fred?
Yeah, Dennis, going back to the medically necessary testing, there was an interesting piece in the TU today,
That's right.
Yesterday. Tell us about it.
So thank you, Fred. That was an op-ed piece that I had written for the Times-Union, and it was on the theme that we've been talking about now for several weeks.
We have.
It was about encouraging people of the Capital Region to know that seeking medically necessary care is something that we want them to do. As I've mentioned in the past, this is an advocacy issue. We spoke about how the medical environment here and other hospitals is safe, and that the COVID-19 doesn't stop strokes, heart attack, cancer, mental illness, and we want people really to be seeking medical care.
We really do, and Dennis, I've been tracking the ED numbers just like you have,
Right.
and we hit a low down around 100 patients a day. I'm happy to say, or I think it's important to say that we're up a little bit, and I think people are coming in who need care. We were in the 130s over the weekend,
Yes.
which is getting a little bit closer to where we should be in terms of appropriate use of emergency services.
And we still offer, for those who are members of our practice, opportunity to do telephone visits or virtual visits in the practice.
Yes.
But the emergency department remains a safe place to seek emergency care.
Very much so. And even the emergent cares, again, safe places, but we also have video visits there as well.
Good. So thank you to the Times-Union for publishing that, and we hope to continue to message that as we go forward. Finally, we just finished today our monthly meeting of our management staff, and we have an award called the iCare Award. CARE stands for compassionate, accountable, respectful, and engaged. And we pick a member of our workforce who we think represents those great values. And this month, we were so pleased to honor Frances Williams. She's an occupational therapist, and she had significant accolades by her coworkers for why she deserved that award.
Absolutely. This is an award that bubbles up from your coworkers. And I think, Dennis, she actually provided care for a family member.
She did. She cared for my mother, who's been in this hospital a couple times, and Frances took great care of her. So we were so pleased to recognize her. And in some ways, Fred, it's nice to be able to do those things because it reminds us that what we're doing here existed before COVID and will continue on, and this award is something that we do every month, and we continue to do it.
Getting back to normal a little bit.
Very good.
Yeah,
all right.
absolutely.
So that's it. We'll be back again tomorrow. We'll dive a little bit more into the numbers, those congregate living numbers as well.
Numbers, yep.
Very good. That'll do it. We'll be back again tomorrow. We ask, as always, you please take care of yourself, take care of each other, and we'll see you tomorrow.